Welcome to another deep dive into the information you shared. We're specifically plunging into excerpts from episode 38, AI in Pharmaceutical Supply Chains and Global Drug Access. And right off the bat, we want to mention welcome to another episode of AI 10X, brought to you by 10 Leaves. So, when we talk about AI and global health, the conversation almost always goes straight to the lab, right? Drug discovery, genomics, disease modeling, all that really spectacular stuff.
Yeah, that's what grabs the headlines.
Exactly. But the material we're looking at today, it pulls the focus somewhere else entirely. It's pointing towards, well, the logistical backbone,
Hmm.
the supply chain.
Mm.
So our mission today is really to unpack how AI isn't just about creating drugs, but how it's transforming the way they actually get to people, turning this, sometimes chaotic system into something equitable and super efficient.
Right. It's this sort of invisible revolution, ensuring that the breakthrough actually reaches the patient. And what's really fascinating here is this growing recognition that the best medicine in the world, well, it's useless if it gets ruined on a hot tarmac somewhere,
Yeah.
or it's just stuck in customs.
Yeah, completely useless.
So the focus really shifts, from the lab bench to what people are calling the last mile. Optimizing that delivery is just as critical, truly, as the discovery itself.
Especially for life-saving meds.
Absolutely. And the implications for global health security are just huge. The old system, it was often brittle, kind of slow, definitely expensive. AI is starting to provide that resilience it, frankly, desperately needs.
Okay, let's unpack that then. Let's get into the nuts and bolts. The sources mention three core ways, sort of concrete functions, where AI is making a real difference right now. It sounds like it's way beyond just, scanning barcodes faster. What is AI specifically doing in managing this incredibly complex global movement of pharmaceuticals?
Right. So we can break it down. The first one, and you could argue it's maybe the most crucial for preventative health, is predicting demand. Traditional systems, they looked at old sales data, maybe simple projections, but AI, it's integrating these vast, often really different data streams to generate much better forecasts.
What kind of data are we talking about? It sounds like more than just what did we sell last year?
Oh, absolutely. The sources point out AI models are pulling in everything. Regional electronic health records, where that's allowed, of course.
Right, data privacy is key.
Definitely. But also real-time consumption data from clinics. Even climate data sometimes, or social media trends that might indicate, disease spread or some regional crisis brewing.
Wow, okay. So give me an example. How does climate data help predict drug needs?
Well, take malaria. By analyzing climate patterns in, say, sub-Saharan Africa, AI can predict the likely timing and the severity of the upcoming malaria season.
Okay.
And then it allows for preemptively shifting antimalarial drug stock weeks, maybe months, before the old procurement cycle would even kick in.
That level of foresight, it changes everything. It's not reactive ordering anymore. It's proactive deployment.
Exactly. Proactive deployment.
Okay, so that's predicting demand, but that relies on trusting the actual medicine that arrives, right? Which brings us to the second point the sources really stress. Detecting counterfeit drugs. This is huge for patient safety.
Massive. It's a constant battle against sophisticated criminal networks.
So how is AI fighting back here?
It's multi-layered, really. First, you've got AI analyzing shipping documents, looking for weird patterns, inconsistencies in the paperwork that a human might just miss.
Like what?
Maybe a vendor suddenly ramps up their order size by 10 times, or a shipment takes a really bizarre route. Stuff like that flags suspicion. But maybe even more exciting is the use of computer vision.
Computer vision, like AI actually looking at the pills or the packaging.
Exactly, looking at the packaging mainly. We're seeing systems where AI uses these high-res imaging setups at checkpoints, and the model is trained on tiny, almost invisible details on genuine packaging, like the exact print registration, how a label aligns, even the texture of a blister pack. It can spot fakes instantly. Plus, many systems are linking up with secure digital ledgers, like blockchain-based track and trace. AI monitors these ledgers, and if anyone tries to mess with a drug's unique ID tag, boom, alerts go out. It creates this constant security mesh.
Okay, that's impressive. So predict demand, verify the product. That leads us to the third function. Optimizing global distribution routes. And this isn't just finding the cheapest flight, is it? We're talking fragile, really time-sensitive cargo.
Yeah, precisely. The huge constraint here is maintaining the cold chain.
Right. Vaccines, biologics.
Exactly. Lots of modern medicines, especially those, need to stay within a really narrow temperature range, sometimes super cold, like -80 Celsius, all the way from the factory to the patient's arm.
So how does AI manage that route planning?
Well, the optimization algorithms are pulling in real-time data from sensors in the shipping containers, monitoring temperature, humidity, even vibration.
Okay.
And then it's dynamically recalculating routes based on everything: unexpected border closures, severe weather forecasts, port congestion.
So let's say a container gets stuck at a hot port because of a customs delay. The AI is already working on plan B.
That's the idea. It might reroute via air instead of truck to make up time, or maybe prearrange expedited customs clearance at the next stop. It's managing air, sea, road transport all at once.
While predicting delays.
Yeah, predicting those friction points like customs, which are, notoriously unpredictable internationally. It learns patterns. This port is always slow on Tuesdays. That country has new regulations.
All to avoid what they call temperature excursions.
Exactly. To keep those sensitive meds safe. It's this blend of extreme efficiency and really strict safety.
The analogy holds up then. The old way was like following a paper map, maybe getting traffic updates. AI is like mission control, juggling millions of variables to guarantee the package gets there safe and fast.
That's a good way to put it.
But connecting this amazing logistics tech back to the bigger picture, the goal isn't just saving fuel or time, right? What's the ultimate result of this faster, safer, optimized system for global health?
Well, the ultimate result, and this is the really exciting part, is a potential leap forward in global health equity.
Okay.
Because the traditional supply chain, let's be honest, it inherently disadvantaged people in low-resource areas. They got drugs last, they faced the highest risk of fakes, they were hit hardest by shortages.
All right.
AI starts to address the big systemic barriers to access. There are sort of four main ways.
Okay, this is where it gets really interesting. Because this tech must be expensive to set up, how does it actually translate into tangible benefits for patients, say, in underserved regions?
Okay, first off, reduced waste. The sources point out a shocking amount of medicine gets wasted globally. Poor forecasting, drugs expiring, temperature failures.
Yeah, I've heard those numbers. They're staggering.
They really are. So by predicting demand accurately, AI cuts down on overstocking and understocking, expensive vaccines, critical drugs. Less of them get thrown away, and the money saved. That could be reinvested, maybe buy more medicine for people who were previously priced out.
Okay, less waste means more available, potentially cheaper meds. Makes sense. What's next?
Well, that directly leads to improved access. If the system forecasts a shortage brewing in country A, the AI already knows which warehouse, maybe in country B, has a reliable surplus.
And the best way to get it there.
And the fastest, safest route. That responsiveness is absolutely critical for managing, say, a localized disease outbreak, or just ensuring people with chronic conditions in vulnerable places get their meds consistently.
That preventative capability you mentioned earlier, moving from just fighting fires to actually preventing them. How does that look when we talk about forecasting shortages?
It looks like stability, ideally.
Yeah.
AI can model these cascading failures. It doesn't just see, oh, factory X has a delay.
Right.
It sees the ripple effect across maybe 40 different countries that rely on that factory. Then it triggers alerts, suggests alternatives, maybe shifting inventory around, using generics temporarily.
Can you give an example from the source?
Yeah, the material mentions organizations using AI to prevent serious antibiotic shortages in several developing nations. They predicted a factory closure 6 months out. Something human analysts looking at fragmented data just couldn't have spotted across that huge network.
That ability to see around the corner, invaluable. But sometimes the big problems aren't huge factory closures. They're the small, frustrating local blockages, right? The fourth benefit is identifying bottlenecks.
Exactly.
Yeah.
AI is really good at pinpointing those persistent local friction points, the things that always seem to slow things down.
Right.
Maybe it's chronic customs delays at one specific port, or a lack of reliable cold storage along a key delivery route in a rural area. Bad roads, whatever it is.
Okay.
The AI highlights these specific spots. That allows NGOs, governments, whoever, to target their investments, infrastructure improvements, policy changes, exactly where they'll make the biggest difference for patients. Not just guessing.
So the AI gives you the map not just to the destination, but it points out the potholes and the roadblocks, administrative or physical, that need fixing first.
That's the idea. Fixing the system for real equity.
But, implementing these incredibly complex, advanced systems globally that can't be easy. What are the big hurdles? What's slowing this down? The sources must talk about challenges.
Well, absolutely. It's not a magic bullet. The sources point to three big ones, really. First is just cost and infrastructure.
Yeah, I figured that would be one.
Setting up the AI models, integrating all the sensors for tracking, training staff, especially in places with limited resources. It's a massive upfront investment. There's a real risk it widens the digital divide before it closes the logistical one.
So you need serious political will, international cooperation, just to get these systems running where they're needed most. What's hurdle number two?
Regulatory fragmentation. Think about it. These drugs cross dozens of borders. Each place has different rules on data sharing, import documents, quality checks.
And those rules can change quickly.
It's exactly. Politics, trade disputes. The AI has to navigate this constantly shifting regulatory patchwork without breaking. A small delay because of paperwork could ruin a whole shipment if it compromises that cold chain.
Right. And the third challenge.
It's fundamentally about data integration. For the AI to predict demand really well, it needs good standardized data from public health agencies, clinics, manufacturers, logistics providers across dozens of countries.
Getting everyone to share data in the same format.
Exactly. It's a huge socio-technical challenge. You're dealing with proprietary business info, sensitive health data. Building that trust and standardization is complex.
Despite those challenges, though, the vision the source paints is really powerful, isn't it? Thinking about a world where patients don't wait months for essential drugs because the system already knows where they're needed most and how to get them there safely. That application of predictive knowledge, that feels like the real sustainable power here. AI using prediction to ease suffering on a massive scale by making distribution reliable and fair.
Yeah, the core takeaway is really that AI is pushing these systems from being just reactive to being truly predictive and resilient. And that shift means equitable access isn't an afterthought, it's baked into the system design, which fundamentally improves global health and, reduces suffering by focusing on the delivery itself.
So, wrapping this up, what does it all mean? It means AI's influence goes way beyond the lab coat, doesn't it? It's becoming this invisible, incredibly complex force, making sure breakthroughs actually get to the bedside.
Right.
We've seen AI isn't just discovering cures, it's making sure they reach people by optimizing, forecasting, protecting the whole delivery network against waste and fraud.
And that leaves us with a final thought, maybe something provocative for you, the listener, to chew on. If AI can get this good at forecasting global drug demand and managing that super complex temperature-sensitive distribution, what other critical global resource flows could be revolutionized? Think about perishable food, disaster relief supplies, maybe even managing clean water infrastructure predictively.
Applying that optimization to other areas of scarcity.
Exactly. What kind of world could that level of predictive optimization create?
Something to definitely think about. You've been listening to this deep dive into the role of AI in supply chains. You're listening to AI 10X, brought to you by 10 Leaves.